Hi, my name is Dr. Ostruchininov. I'm founder of Science and Massage Institute located in Phoenix, Arizona. We are right now in a medical massage seminar, which we are conducting at the Arizona School of Medical Massage and Wellness. First medical massage school in the United States approved by local medical board, in this case Arizona Medical Board, to teach medical massage. We think that's incredible achievement. And what we would like to share with you clinical case presented of one of our students who's still going through the process of medical massage certification. Clinical case, she was able to fix and decisively change patient life. From our perspective, incredible. And that's the reason for this short video, when you can see and witness first time from the therapist what 10 fingers of yours can do and how they can change the life of the patients.
So my name is Janna, and I am a massage therapist in Vancouver, Washington. Female client came to see me. Her husband had started to have a groin pain over 2 years ago, just in the right groin pain. Went to see doctors, and doctors does a whole bunch of tests, and refers him, I think, to a surgeon. They say, well, we think you have a hernia. So they schedule him for hernia surgery and get him on the table, and they're like, oh, you don't have a hernia. It looks like you have a lipoma, the fatty tissues that develop, but we're still gonna put a mesh in there. And so they send him home, and he's like not getting better at all, still progressively getting worse. He goes back to his doctor. His doctor sends him back to the surgeon, and he's suspecting maybe the mesh is irritating or something. And they're like, no, mesh is not irritating. So basically they give him pain medication, muscle relaxant, and refer him to PT. So now when I'm like, already suspecting that there might be irritation of the nerve somewhere that's probably prevented, I'm like, let me get him on my table. So I get him on my table, and I go and evaluate his low back. And I go through the doctor's guidance, evaluate first, examine first. So I go through examination, and I find the very painful, very restricted areas in his low back and in his right glute muscle. And I do the treatment. Just from the first session, I do the treatment, I decompress, hit the super tight, painful muscles. He's walking in to see me with pain, like he's barely walking. Like I watch him and he's like limping in a lot of pain. Just after first session, he comes out, he says, Janna, 80% better, like I have no pain. So just this week before the seminar, I saw him for the third session. He's still saying no pain. I haven't had to take any pain medication since first this treatment. He's like, you literally, like, you saved my life. He took on another construction project to finish and to do. He's like, I have no pain at all. I'm jumping through the stairs. My wife tells us, slow down. You're gonna ruin what Janna has done for you. And he's just literally, because I was able to find the source. Now, not even in the groin area, but find the source by examining and by testing the low back, testing the muscles. I was able to decompress the issue. And so he's so much better now. We're still working on it because I still wanted to remove the guarding and the tension of the muscles. But he literally is so much better. Then he shares with me that with all these issues, he's been having issues with erection. And he's like, Janna, everything is working fine now. Third session, well, he came in the third session, so after first 2 sessions, he says, everything is working fine. And I'm like, oh, wow. It was just so exciting. I was in awe, so I was like sharing with Dr. Ross. I could not believe it, like first session, just what I've done, fix the issues that doctor could not address. And unnecessary surgery.
We have large number of therapists who flew from different parts of the country, and they're going through different stages of certification in medical massage, from the first seminar to almost finishing the program. And they are growing from seminar to seminar with their evaluation skills and the clinical application. And the goal of our program is to make therapists independently thinking massage clinicians while provide decisive help in the complex medical conditions which can be addressed through the somatic rehabilitation. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future.